guys, welcome to our channel MBPS Diaries. Today's topic is on the thoracic outlet syndrome. It's based on the neck, head and neck anatomy. So, in the previous lecture, we discussed about the anatomy of thoracic outlet, which will help in this lecture, in thoracic outlet syndrome. So, first of all, what is the definition of thoracic outlet syndrome? Or what do you mean by thoracic outlet syndrome? It's actually a compression or irritation of brachial plexus elements, or you can also say due to the involvement of subclavian vein or subclavian artery. Now we discuss about the structural cause of thoracic outlet syndrome in the next slide. Now you can see the reasons for this syndrome. First one, that is cervical ribs. Now you can ask how cervical ribs is responsible for this syndrome. So you can see in picture that if there is any deformity, suppose like here I'm using green, or something you can say here, or you can assume here. So it can compress the elements passing through here, like artery or nerves, or you can say here it's veins. It can compress the elements passing through here and cause this syndrome. Now coming to our next point, that is fibrous bands. It's running through this region, compressing some of the structural outlet elements. Is just like the same concept from the previous one. Now the next one is hypertrophy of skeletal muscles. This hypertrophy of skeletal muscles that could compress or put pressure on the elements passing through the interscleral triangle. As I said to the previous lecture, so the brachial plexus trunks and could be involved here, or the subclavian artery. Here you can see the triangle, and if this muscle compress, I'm using black here, to brachial plexus, and it's a brachial plexus. Here I'm using yellow. Here is a brachial plexus, and this is interscleral muscle. We already discussed about this muscle in previous lecture, and the deformity occurs. Now talking to our next point, that is anomalous muscle, which is also responsible for compressing the elements passing through there. These all are in same concept. And the last one, that is Pankos tumor. If you want to know about this tumor information, then I am giving you a short definition about it. It's a long tumor, passed superiorly, and involve structure of the thoracic outlet, which can also affect to the brachial plexus. Its effect on brachial plexus. The tumor may happen here. I have to use magenta color here or here, and it affect to what? this brachial plexus. This is the brachial plexus. Okay. Now coming to our next part, that is symptom of thoracic outlet syndrome. I am using short form of thoracic outlet syndrome. Please cooperate with me. So first point about the symptoms of thoracic outlet syndrome, that is numbness and pain along the medial arm, forearm and fourth and fifth digit of your hands. You can see in picture here, you feel pain in the forearm all side along with fourth, this one is fourth and this one is fifth digit of your hand. This pain will go along your forearm and ends here. And how it happens, if you want to know the reason, this is due to the involvement of the inferior trunk region of brachial plexus, the C8 and T1 dermatomal areas that supply the skin of this region. Now the second symptom of thoracic outlet syndrome, that is muscle weakness in the hand. And how it happens, then happens due to the intrinsic muscles are innervated by T1. So if there is compression of the inferior trunk, then you can have muscle weakness in the hand. It also affects the forearm along with, but not in this region. It ends here only. It ends here only. It doesn't go to hand like the first one. It just ends here. Now the third symptom of thoracic outlet syndrome, that is swelling of the arm. The reason behind it is due to the involvement of subclavian vein that would decrease venous return to the heart, and that would occur swelling of the arm. Swelling happens here in this region, or you might see swelling here or here. Now the last and the final symptoms of thoracic outlet syndrome, that is pallor and coldness. It happens due to the involvement of subclavian artery. Now just remember, the previous one, the symptoms of thoracic outlet syndrome, that is swelling of the arm, it happens due to what? Involvement of what? Subclavian vein. And here you can see it's due to subclavian artery. So when subclavian artery is compressed and narrowed, then it can lead to what? Pallor and coldness. Now we are coming into our next part of the lecture, that is on the carotid and subclavian arteries. We will see here about their branches and about the symptoms happens due to carotid artery damage or subclavian artery damage. Now moving to our next slide, that is on the carotid artery. Carotid arterial system is divided into three. Here it is written very clearly. First one is external carotid artery, second one is internal, and the third one, what? Common carotid artery. Okay. Note that external carotid artery have 8 branches. We will discuss those branches in the later slide. You can see here in the picture. Can you guess which one is external carotid artery and which one is common carotid artery and which one is internal carotid artery? So here is your answer. This one is common carotid artery. I am using green for common carotid artery. This one, common carotid artery. Now, along with common carotid artery, you can find external carotid artery, that is here. I am using magenta color for indicating the external carotid artery. This one is external. I am using black dot so that you can understand. And the last one, that is internal carotid artery, it is behind, just behind here. I am using red to indicate internal carotid artery. This one is internal carotid artery and this one is external carotid artery, ECA. I am using short. So from now you can easily identify which one is external carotid artery, which one is internal carotid artery and which one is common carotid artery. Now we will discuss about the 8 branches of external carotid artery in our next slide. Here you can see we have 8 branches. First one is what? Superior thyroid artery. It is located where? I have to use black color for this. No, I have to use green color. This one is your superior thyroid artery. Now next one, that is ascending pharyngeal. Now you can guess where it is present. Ascending pharyngeal artery. Yes, this one is this. I am using magenta color for ascending pharyngeal artery, or I am using a number so that you can understand. This one is 2. Or this one is 1. So ascending pharyngeal and superior thyroid. Now the third one, that is lingual artery. I am using blue for the lingual artery. Number 3 is here. Next is facial artery, which is just beside the lingual artery. I am using yellow for this. I have to use black. It's not visible here. This one is facial artery. Now the next one, that is occipital artery. Now coming to our next artery, that is occipital artery, which is present here. I am using magenta for occipital artery. Here, this one is 5. I am using black spot to identify it. Now the 6th one, that is posterior auricular artery, which is here, just above it. So I am using blue to identify it. This one is posterior auricular artery. 6. Occipital artery and the posterior auricular artery. Now the 7th one, that is what? Maxillary artery, which is here. I am using green for maxillary artery. and a black spot to identify it. And the last and the final one, that is superior temporal artery. This one is very important artery. We will discuss about this artery later. And I have to use what, black. I'm using black to identify it. This one. Okay. So how can you remember this all 8 branches of carotid artery? You can find many mnemonics on in the Google or in the internet. So again, just to revise, I will discuss every branches of external carotid artery in one slide. So first, superior thyroid, that is here. I'm using short form, please cooperate with me. Superior thyroid. Next one, that is ascending pharyngeal, which is present here. This one. AP, I'm using AP for ascending pharyngeal. Third one, that is lingual artery. It is present here. LA for the lingual artery. Fourth one, that is facial artery, which is here, FA. Fifth one, that is occipital artery, which is present here. This one, actually it goes inside, and this one goes inside and coming from here. Actually it supplies to the occipital bone. And the sixth one, occipital artery is over. Now the sixth one, that is posterior ocular artery, that is here. This one, I will use the black, posterior ocular artery. Now the seventh one, that is maxillary artery. It is here. It supplies to the maxilla. And the last, that is superficial temporal artery, which is present here. Superficial temporal artery. Right? Now we discuss about some coronary artery disease. So here we have superficial temporal arteritis. What do you mean by itis? If you read medical terminology, then you can easily understand about the medical term. This itis means inflammation. Okay, so if you want me to say the definition of superficial temporal artery, so I have to just say that it means your superficial temporal artery is going to be inflamed. Just this. When it becomes inflamed, it will have associated symptoms, suppose like headache. You may have headache on the involved side. Don't think it's a migraine. It's a headache from on involved side where inflammation occurs. And the next one, that is scalp tenderness on the involved side. Just point to be remembered, that nothing else. Here you can see in the picture, this is your temporal artery. I'm to use yellow, sorry, black, superficial temporal artery, as we discussed in the previous slide. And headache will occur here. I'm using blue. Or headache may occur, you can feel the headache will also spread to like this in arc shape. You will feel pain and also difficulty in sleeping, and I think you can't sleep with this pain. Now we discuss about our carotid artery disease. uh, Another clinical correlation of carotid artery disease is atherosclerotic buildup, which is substantial narrowing and then ultimately complete stenosis of the carotid artery, which can result in like stroke symptoms. That could be a thrombus, and that forms that completely obstruct carotid artery system. It also block everything in carotid artery system. It might be embolus, and that would then occlude the atherosclerotic narrowing of the artery. Some of the symptoms of carotid artery disease, here you can see in the slide. Sudden numbness, first one. And the second one is difficulty in speaking, visual disturbance. This all happens due to because of the branches of carotid artery is numerous. And the fourth one, that is sudden dizziness. And the fifth one, that is sudden severe headache. Headache may also happen due to carotid artery disease. Now we are discussing about our last artery, that is subclavian artery, which have four branches, as you can see in the slide. First one, that is vertebral artery, which supply blood to the brain along with internal carotid. As you can see in the picture here, I'm using red color to identify the vertebral artery. Next one is thyrocervical trunk. It is here. I'm using green color to identify it. Third one, that is internal thoracic artery. It descends along the lateral margin of the sternum. Here, if it is sternum, this is manubrium. If this is sternum, then it descends and goes along the lateral margin of the sternum. Okay, and the last one, that is called what? Costocervical trunk. Right, now coming to our last topic about this lecture, that is on the vertebral artery syndrome. This vertebral artery syndrome can cause due to the atherosclerotic lesions of the proximal vertebral artery, or by dissection of vertebral artery proximal to it entering the transverse foramen. As you can see here, it is written already, and it can cause what? Dizziness, diplopia, bilateral leg weakness, numbness, and hemiparesis. So here I'm ending my lecture. Our next video is upon circle abilities. Thank you for your patience and thank you for watching. Please like and subscribe to my channel.